Good day, ma'am. I'm Jimaros Rivas from Asian College Foundation. Now I'm going to perform the EINC return demo, which is the Essential Intrapartum Newborn Care. The protocol is a package of evidence-based practices recommended by the Department of Health as the standard of care in all births for healthcare workers and medical practitioner under A0200900025 dated by December 1, 2009. It aims to ensure that health workers have at the most vulnerable period in baby's life through the EINC protocol. There is a potential to decrease newborn death by activist half. Knock the door and greet the patient. Good morning, ma'am. By the way, ma'am, I am your student midwife for today. I am Jimaros Rivas from Asian College Foundation. I am here to help you and guide you before the delivery of your baby. So, how are you feeling right now, ma'am? Okay, it's okay. Thank you, ma'am. So, ma'am, your cervix is not yet fully dilated. It is only 8 centimeters. So when waiting, just relax and calm down. And please do not drink or eat any kind of food before delivery. It is okay, ma'am? Okay, thank you, ma'am. Take note that it is not advisable for the pregnant mother to eat or drink any kind of food because she will just excrete it during her delivery. So, the preparation for the delivery first is to check for room temperature. It should be 25 to 28 degrees Celsius and free of air drops. So, the temperature of this room is good. It's 25 degrees Celsius, no air. So, it's okay. So, now we are going to check if the mother is comfortable with her semi-upright position. So, hi ma'am. Are you comfortable with your position right now, ma'am? Okay, thank you, ma'am. Because we all know that semi-upright of the total position are the default position for the delivery. So now, remove all the jewelries and do proper hand hygiene. So now, then check all the needed equipment. So we have the vitamin key, the hepatitis B, the BCG vaccination, those sterile gloves, the bonnet, eye ointment, then oxytocin injection by the syringe, kidney basin, cord clamp, and scissors. And also the dry, clean linen. After that, perform sterile technique and hand washing. So now I'm done for doing the hand washing. So I'm going to wear a two sterile gloves. So this is the two set of sterile gloves. So, right into the patient room. At the time of the delivery, encourage the mother to push. Mom, relax. Inhale, exhale, then push. Exhale, inhale, then push. Inhale, exhale, then push. 1, 2, 3, push. 1, 2, 3, push. Then, represent a dry, clean linen across the mother's abdomen and arm in preparation for drying up the baby. Then, then apply previous support and control and delivery of the baby's head. Okay, mom. 1, 2, 3, push. 1, 2, 3, push. 1, 2, 3, push. Then support the gauze into the anus. 3, push. Baby's out. 12:30 p.m. Then put it into the mother's abdomen. Then for 30 seconds, thoroughly dry the baby. Okay, from dry. And then wipe the eyes, the face, the head, the trunk, arms, and legs. And then remove the wet linens and place the baby into skin-to-skin contact on the mother. Mother chest and abdomen in a prone position with facing at the left side. Okay. Then cover the baby with dry clean linen and bonnet. Then cover the baby and use the clean linen and also the bonnet. So the purpose of skin-to-skin contact are to promote mother and child bond, breastfeeding success, lymphoid tissue system stimulation, exposure to maternal flora, protection from hypoglycemia, and also to help thermoregulation. So now exude the second baby by palpating the mother's abdomen in preparation for giving oxytocin injection. I am within 1 minute after the baby's birth. So the purpose of giving oxytocin injection to the mother is to prevent hemorrhage or excessive bleeding after the vaginal birth. So now I'm going to the uh, cord care. So first remove the first glove, then remove the first glove. Then discard. So the cord care, so palpate first the cord. And after palpation of stop, clamp the cord using the plastic cord clamp at 2 cm from the umbilical base. So 2 cm using the plastic cord clamp. Then melt the cord away from the baby, gently slightly away from the baby. Squeezing the blood along the umbilical cord helps boost the baby blood volume, and this may improve the baby's tongue. Then clamp up the 5 cm from the base. Then cut the umbilical cord just near the first clamp Then rub the umbilical cord at the scissors and put it into the kidney basin. So after that, perform the remaining steps of the active management for the next stage of labor. Wait for a strong nutrient contraction, then apply control contraction in the uterus, continuing until the delivery of placenta. Massage the uterus until it bursts, then inspect lower vagina of urine for any laceration. Okay. So, uh, ready for the kidney basin. After the placenta has been delivered, examine and check if it is complete or if has any abnormalities. So the placenta is complete and has no abnormalities. And then put it into the kidney basin. Then clean the mother by flushing the perineum and apply perineal pads, napkin or cloth. Check also the baby's color and breathing. So the baby's color and breathing are normal. Check also the mother if it is comfortable. So are you comfortable, ma'am? Okay, thank you, ma'am. And also check the mother if the uterus is contracted. So dispose the placenta in a leak-proof container in plastic bag. Decontaminant soak in 0.5% of chlorine solution and rinse before cleaning. And decontaminate the second pair of gloves before dispose. The contamination should last at least 10 minutes. And don't forget, then advise the mother to maintain the skin-to-skin contact with his baby. The baby should be prone on the mother's chest in between the breast with thread turned into one side. Also advise the mother to observe for breastfeeding uses. Ma'am, please maintain skin-to-skin contact with your baby. Okay, then please be aware of the breastfeeding cues such as mouth opening, lip licking, and sucking. Bringing hands to mouth, moving heads as is looking for the mother's nipple. Clenching of fists and fingers over the tummy, bending of arms and legs, and fastness. After that, support the mother, instruct her on positioning and attachment, and wait for full breastfeed to be completed. After complete breastfeed, administer eye ointment to protect the baby from an unknown gonorrhea infection in the mother's baby. So I'm going to administer the eye ointment for the baby to avoid the any infection from the mothers. Next, to perform physical examination. They are going to administer the vitamin K to prevent low levels of vitamin K. So vitamin K is to prevent low levels of vitamin K and vitamin K deficiency bleeding. So vitamin K 0.5 ml IM vastus lateralis or in the right leg of the baby. The next is the hepatitis vaccine to protect the baby as early as possible from any exposure to the hepatitis B virus. Hepatitis B vaccination 0.5 ml IM vastus lateralis in left leg. Then lastly, the BCG vaccine to protect the baby from serious form of tuberculosis such as TB, meningitis, infection of the brain, miliary TB, widespread of infection, is administered intradermally in the arm of the baby. Then advise the mother for optional delayed bathing of the baby after 6 hours because the lead bathing provides more initial skin-to-skin contact between you and your baby, and early watching changes curling reflux is can also add to hypothermia, which means that the body temperature of your baby drops below normal but also lead infection, defect, acidosis, or brain hemorrhage. And whenever your baby wants to breastfeed, just breastfeed him. Okay, ma'am? Okay, thank you, ma'am. So, okay, ma'am? Then, in the first hour, checking the baby color and breathing. Check also the mother's vital sign and massage uterus every 15 minutes. So, check the baby's color and also the breathing. And also the vital sign of the mother and massage the uterus every 15 minutes. In the second hour, check mother-baby diet every 30 minutes to 1 hour. And lastly, records all the procedure. And also, after all the procedure, don't forget to remove your gloves and do the proper hand hygiene. And that's all the essential intrapartum newborn care. That's all. Thank you.